questions focused on histoplasmosis, including diagnosis, clinical presentation, and treatment with detailed explanations. Question 1. Clinical presentation and epidemiology. A 42-year-old spelunker presents with fever, fatigue, and a dry cough. He recently explored caves in Kentucky. Physical exam reveals splenomegaly and oral ulcers. Laboratory studies show pancytopenia. A peripheral smear shows small intracellular organisms within macrophages. Which of the following is the most likely diagnosis? A. Coccidioidomycosis. B. Histoplasmosis. C. Tuberculosis. D. Blastomycosis. E. Toxocorrect answer. B. Histoplasmosis. Explanation. Histoplasma capsulatum is endemic in the Mississippi and Ohio River valleys, associated with bat and bird droppings. Classic presentation includes splenomegaly, pancytopenia, oral ulcers, and intracellular yeast in macrophages, seen in cave explorers, spelunkers, or in areas with exposure to bird-bat droppings. Why not the others? A. Coccidioidomycosis, found in the southwest U.S., not in Ohio River Valley. C. Tuberculosis, causes granulomas but does not appear as yeast in macrophages. D. Blastomycosis, shows broad-based budding yeast, not intracellular. E. Toxoplasmosis, affects immunocompromised, not associated with bat droppings or pancytopenia. Question 2. Diagnosis. A 34-year-old man presents with fever, weight loss, and non-productive cough. He recently returned from a trip to Missouri. A chest X-ray shows hilar lymphadenopathy. Lab tests show elevated liver enzymes and pancytopenia. Which of the following diagnostic tests would be most helpful to confirm the suspected fungal infection? A. Sputum acid-fast stain. B. India ink stain of CSF. C. Urine or serum antigen detection. D. Thick blood smear. E. ELISA for HIV antibodies. Correct answer C. Urine or serum antigen detection. Explanation. Urine serum antigen testing is the most sensitive and non-invasive method to diagnose histoplasmosis, especially in disseminated disease. Organisms are often intracellular, so direct staining or culture may miss it. Why not the others? A. Acid-fast stain for Mycobacterium tuberculosis, not fungi. B. India ink for Cryptococcus, not histoplasma. D. Thick smear for malaria, not relevant here. E. HIV ELISA may be relevant if evaluating immune status, but not diagnostic for histoplasma. Question 3. Treatment. A 50-year-old man with a history of travel to the Ohio River Valley presents with fever, weight loss, and mucocutaneous ulcers. Lab tests reveal pancytopenia and elevated liver enzymes. Histopathology of bone marrow biopsy shows macrophages filled with small yeast forms. What is the most appropriate treatment for this patient's condition? A. Itraconazole. B. Fluconazole. C. Amphotericin B. D. Rifampin plus isoniazid. E. Keto. Correct answer C. Amphotericin B. Explanation. Amphotericin B is used for severe or disseminated histoplasmosis, especially in immunocompromised patients or those with systemic signs, e.g. pancytopenia, organ involvement. For mild to moderate disease, itraconazole is preferred. Why not the others? A. Itraconazole, good for mild-moderate disease, but not for severe disseminated infections. B. Fluconazole, less effective against histoplasma than itraconazole. D. Rifampin plus isoniazid, TB treatment not antifungal. E. Ketoconazole, obsolete due to toxicity and ineffectiveness compared to itraconazole.